Hello and welcome. Today we are going to spend some time learning about ischemic stroke, some signs to look out for, what ischemic stroke means for your body, and what you need to know about this neurological disease. So, what exactly is a stroke, you ask? The leading cause of disability and second leading cause of death worldwide is stroke. The World Health Organization classifies a stroke by being the sudden onset of neurological symptoms attributed specifically to a brain disorder, secondary to a circulatory disorder, lasting a period greater than 24 hours. Strokes can be subdivided into two categories: hemorrhagic and ischemic stroke. Ischemic stroke is the most prevalent type, accounting for 3/4 of stroke incidents, and will be our focus today. Ischemic stroke is an infarction, or blockage of blood flow to the brain's blood vessels, spinal cord or retina. Arteries are more commonly affected than veins, with the internal carotid artery and the middle cerebral arteries being the most commonly affected of the arterial vessels. The blockage of blood flow is most often the result of a blood clot. These blood clots can form as a result of cerebral arterial plaque buildup over time, known as cerebral arteriosclerosis, which can eventually block blood flow to the brain. Atrial fibrillation and stenosis of the carotid artery are also common predisposing factors of ischemic stroke. This blockage can also occur if a clot forms in another area of the body's vasculature system and travels into the brain, blocking blood flow and resulting in an ischemic stroke. Each region of your brain is responsible for controlling specific functions of your body, from walking, speaking, and hearing, to laughing, crying, memory, and comprehension. Depending on where blood flow has been blocked within the brain's blood vessels will determine which body functions will be affected. If there is a prolonged absence of blood flow, the affected regions run the risk of permanent damage and tissue death. The immediate acute phase of an ischemic stroke is a serious, time-sensitive emergency. Time equals brain function, and the sooner emergency actions are taken, the greater chances for a more positive outcome. This is why it is crucial to recognize the signs and symptoms of ischemic stroke.
As we mentioned, an ischemic stroke is a serious neurological event caused by lack of blood flow to the brain. As a result, the signs and symptoms are linked to its neurological deficits from the affected area of the brain. Areas of the brain dependent on blood flow from the middle cerebral artery are most affected. These areas are responsible for sensory, motor, and speech functions. As these areas become deprived of oxygenated blood, deficits form as a facial droop, weakness or sensory loss of the arm, dragging of the leg, difficulty with speaking or slurred speech, headache, dizziness, blurred vision, and sudden confusion or comprehension problems. These symptoms commonly affect one side of the body, but may affect both. A helpful tool to remember the signs and symptoms of ischemic stroke is to think fast. F for facial droop, A for arm weakness, S for speech difficulty, T for time to call 911. As we spoke about earlier, an ischemic stroke is an extremely time-sensitive medical emergency. If any of these signs or symptoms are being experienced by you or someone else, do not hesitate to seek immediate emergency help. Time equals brain. Often the damage caused by an ischemic stroke can be reversed, but you must think fast.
Depending on the location of the blockage that causes the ischemic stroke, there are a number of organs or systems that can be impacted. The brain cells that the blood flow normally goes to will start to die without adequate blood flow. Permanent damage to brain tissue can result from an ischemic stroke and affect parts of the body even after the event. People that suffer from a stroke can have issues with thinking and with their memory. They often have difficulty recalling things or solving complex problems. Additionally, they may have difficulty with speech or understanding someone. Their cognition can be affected after a stroke. They can also have issues with controlling their emotions. Emotional issues are common after a stroke. Not only can a stroke affect their outlook and mood, but it can also damage the structures of the brain that control emotions. For example, someone that suffered from a stroke may cry uncontrollably. Unfortunately, emotional issues tend to improve over time. They may also have difficulties making decisions and changes to their personality. These changes could indicate that there has been damage to the part of the brain that controls their behavior. Other body systems that a stroke can affect are the eyes. Some may have visual problems after a stroke. They can also lose the ability to judge space and time, or they may have blurry vision and have trouble seeing clearly. They may also have difficulties with hand-eye coordination. This can result from nerve communication problems and muscle weakness. Eating and swallowing may also become difficult after a stroke. This is due to paralysis of the body parts involved in eating and swallowing, like the tongue, throat, or mouth muscles. Other body systems that can be affected by an ischemic stroke can include the body's ability to regulate their temperature. Patients may find that they become too hot or too cold more easily. They may also be more easily fatigued and have a lower endurance. This is common after a stroke, and patients will need to adjust their activity levels to meet their needs. They may have issues with the respiratory system and have difficulty breathing due to swallowing issues. Swallowing issues can cause an infection or pneumonia because of food or liquid getting stuck into the airway. The patient may also have reduced sexual ability. Paralysis or muscle weakness may make it much more difficult, if not near impossible, to engage in sexual activities. The right or left side of the body may experience loss of feeling or movement. A stroke that occurs on the left side of the brain will affect the right side of the body, and a stroke on the right side of the body will affect the left side of the brain. Incontinence can also be an issue after an ischemic stroke. Damage to the parts of the brain that control bladder and bowel function can cause dysfunction and make patients unable to control their bladder or bowels. The body is affected from a stroke depend on the location of the ischemic stroke in the brain. The symptoms or body systems affected can help indicate what area of the brain has been affected by an ischemic stroke.
Certain factors can increase your chance of experiencing an ischemic stroke. These risk factors include smoking, hypertension, poor nutrition with diets high in fat and salt, high cholesterol levels, obesity, predisposing heart disorders such as atrial fibrillation, age, and race can all contribute to an increased risk of ischemic stroke. A client who is recovering from a stroke, there are some important key things to consider when providing patient-centered care. Monitor vital signs every 1 to 2 hours. Monitor changes in the level of consciousness. Monitor for hyperglycemia. Elevate the head of the bed about 30 degrees to reduce intracranial pressure. Institute seizure precautions. Assist the client with communication skills if their speech has been impaired. This can be very frustrating for a client. Asking yes or no questions can be helpful. It is important to speak slowly and clearly. Assist with safe feedings. A client recovering from a stroke should not be left alone while eating due to choking hazards. Provide prevention measures of pneumonia, pressure injuries, and deep vein thrombosis. This also includes providing teaching if the client has one-sided neglect and teaching them to protect the extremities that have been paralyzed. ROM exercises should be encouraged every 2 hours. Elastic stockings can be initiated to reduce swelling and promote venous return in the lower extremity. Help the client with daily living activities. Maintain a safe environment to prevent fall risk. Lastly, it is important to acknowledge a client after a stroke may be experiencing emotional distress. Support the client during periods of emotional lability and depression. Okay, now that you have some new knowledge on ischemic stroke, it's pop quiz time. A nurse is assessing a patient. Which of the following findings indicates that the patient may be suffering an ischemic stroke? Select all that apply. A. The patient is complaining of abdominal tenderness. B. The patient is experiencing sudden confusion. C. The patient presents with excessive bruising. D. The patient is showing difficulty speaking. E. The patient is complaining of weakness in their arm with decreased mobility. B. The patient is experiencing sudden confusion. Rationale. As blood flow is restricted to the brain, individuals experiencing ischemic stroke can present with central nervous system manifestations such as dizziness, blurred vision, and confusion. D. The patient is showing difficulty speaking. Rationale. Slurred speech or difficulty forming speech are classic symptoms indicative of ischemic stroke. E. The patient is complaining of sensory loss and weakness in their arm. Rationale. Individuals experiencing an ischemic stroke often presents with motor deficits, such as muscle weakness in extremities, or sensory loss, such as lack of feeling in extremities. A. The patient is complaining of abdominal tenderness. Rationale. This is not indicative of ischemic stroke. C. The patient presents with excessive bruising. Rationale. This is not indicative of ischemic stroke. 4 days following a stroke, a patient has been authorized to start oral feedings. Before feeding the patient, the nurse knows that which interventions would be appropriate for this client who is at risk for aspiration. Select all that apply. Maintain the head of the bed at least 30 degrees or greater while eating or drinking. Ensure that the client is receiving their favorite foods, to ensure caloric intake is sufficient. Ensure the client is supervised while eating or drinking, observing for signs of aspiration and choking. Advocating for evaluation of the client by a speech-language pathologist. Allow the client to watch television while eating and drinking. Correct answers. A. Maintain the head of the bed at least 30 degrees or greater while eating or drinking. Rationale. The client needs to be in an upright position and swallow with the head and neck flexed slightly forward. C. Ensure the client is supervised while eating or drinking, observing for signs of aspiration and choking. Rationale. The client must be assisted to ensure safe feedings. If the client is left alone, there are no preventive measures for aspiration. D. Advocating for evaluation of the client by a speech-language pathologist. Rationale. There are different levels for dysphagia, including puree, mechanically altered, advanced, mechanically soft, and regular. There is 4 liquid consistency for dysphagia: thin, nectar-like, honey-like, and spoon-thick. The SLP can request a swallowing study to determine which one is recommended to minimize choking. As the client is recovering from the ischemic stroke, their swallowing capability may change. Wrong answers. E. Turn on the television, allowing the client to watch television and visit with visitors while eating and drinking. Rationale. As a nurse, it is important to maintain a distraction-free environment during meals. Clients recovering from a stroke often experience weight loss and do not have sufficient caloric intake. B. Ensure that the client is receiving their favorite foods, to ensure caloric intake is sufficient. Rationale. The client will be on a prescribed diet determined by the SLP. The nurse should ensure the client's meal matches the placed order after the swallow test.